Hi, today I'm here at Ideal Face and Body in Beverly Hills for my Radiant Facial. I'm super excited to get a facial treatment to help the overall presentation of my face in terms of skin tone, reduce the wrinkles, and reduce my pore size. So I'm getting ready and here we go.
Hi, I'm Dr. Sarah Jovino, and here's our PRP kit, the gold standard. It comes with the PRP tube, a butterfly to remove the blood, a tourniquet, and alcohol wipe. Cleaning the skin here. Tiny little needle. Here we go, 3, 2, 1 pinch. That's it. It fills up on its own and will automatically stop when it's over. That's it. So now we'll take the test tube out and we'll go spin it in the centrifuge. So now we're going to put it into the centrifuge so it can spin and separate the platelet-rich plasma from the red blood cells. We'll take approximately 10 minutes to start. We're now going to begin the radiant facial. It first starts with the radiofrequency ablation of the skin. I first like to start with the forehead. I'm going to clean off his numbing medicine. First, I'm going to wipe it off, and then I'm going to clean it with some alcohol as well to get the skin nice and clean. I like to do it in sections. First, we start with the forehead, and then we move to the lower face. So we've already done this lower strip of the forehead, and as you see, there's some erythema and a little bit of swelling that's been associated with this procedure. It is normal to swell slightly after this procedure, but using your PRP or their own plasma does help to reduce that swelling. So as you can see, over the areas that I've already gone, he is a little bit red, which is normal. It's like a sunburn. This will brown after about 2 days, typical to a normal sunburn when you go outside. So I'm just finishing up with the forehead in this direction. Few more pulsations. Here's the last one. And now I'm going to start back over and I'm going to go in this direction. So I'm cross-hatching. I'm sorry?
And what would you be doing here? Is this the first pass or second pass?
This is the second pass. This is to make sure that no spots had been missed in the one direction. As you see, as you come across, there's some areas where because of the roundness of his forehead, all sensors don't end up. So now I'm doing the Venus Viva on the nose. This will help decrease pore size and decrease the incidences of blackheads. Most patients report even after one treatment that they can tell that their pore size has shrunk down dramatically. The Radiant Facial is a nice complement to Botox around the eyes, especially around the crow's feet, to help reduce wrinkles and smooth out the texture. Just finishing up on the chin area here. We're almost done with the full face. Once we're done with the full face, I will lay the PRP down and start the microneedling process. So now I'm going to remove the platelet-rich plasma from the test tube. You can see how it separated the red blood cells from the plasma into a fresh syringe. And then I'm going to attach it to a 32 gauge needle. Here we go, we're ready to start the microneedling process. We just finished the radiofrequency portion, and now we are moving on to the microneedling with PRP.
How you feeling, Stacy?
Good. It's like using an electric razor.
PRP is used as a topical agent for the glide for the microneedling, but it's also used to inject under the skin to stimulate collagen growth and as a filler. So I'm going to inject his 2 scars that he has here to try to give him a little bit better result than if I hadn't done that at all. So I'm just going to inject a little bit of PRP into the scar here to help with its regrowth.
How's that feel, Stacy?
No, that was not. I didn't feel it at all.
Great.
And here I'm going to inject into this scar here. You can see a little bit goes a long way in there. Now another concern this patient has is his male pattern balding right here. The platelet-rich plasma can be injected right underneath the skin when coupled with the microneedling to help stimulate new hair growth. I'm going to be injecting it right here in the hairline to try to stimulate new hair cells from forming.
One.
Hi, just finished with the radiant facial. Dr. Jovino did a great job. It wasn't that painful. It was tolerable. She put some lidocaine on my face beforehand, so I felt the pain was maybe at 3, 4 maybe at most. So now I'm just going to go home, rest, and get ready for work tomorrow. Thanks.